First of all, thank you all so much for being here today from wherever you're zooming in from. I hope that the conference so far has been interesting, and I'm looking forward to hearing your thoughts and questions at the end of my presentation. So just to introduce myself, my name is Mitra Alikhani. I am a second year medical student here at Stanford, and I am here to talk to you today about AI and specifically how it can be used to optimize education. In my experience, this would be for medical education, but I think a lot of what I'm going to talk about today will be applicable to whatever background you have and whatever you're coming into this conference with, and any questions that you want to address in your own educational practice. You might be also wondering, what does a random medical student have to teach educators about AI? And I think that in many educational settings, students are really the ones who are first adopters of AI right now. Many students are already using AI in pretty innovative ways in their own practice and their own learning. So definitely ask your students what they're doing, because I think oftentimes you might learn something from how they're optimizing their educational experience. A little bit of background about me. Before coming to medical school, I was an ICU nurse. And the reason that I bring that up is that I'm not a computer programmer. I have very little technical background. And so I think it's important for people to know that what I'm talking about today are things that anybody in any stage of life can use, regardless of your technical proficiency or if you have any background with computers. Anybody can use these tools. So first of all, I have no conflicts of interest, which is sad for me, but good for you, because it means that everything that I'm talking about today are things that I genuinely use and recommend, not because I'm receiving any money or kickbacks, but simply because I think that they're useful tools. And then there's going to be quite a few bits of information and strategies and pipelines that I'm talking about in this presentation. There will be a QR code at the end that has a summary of everything that I talk about today. So don't feel pressured to write everything down frantically. You'll receive a summary at the end as well. So my goal for today is basically to talk about how educators can use AI to make their teaching more effective and efficient, and how students are already using AI and how you can assist students in using AI to better learn more efficiently. So the things that I'm going to be talking about today are, first of all, how you can take a source material, whether that's slides, whether that's the most recent literature, 10 recent papers on your topic that you are teaching on, and how to turn that into an outline or lesson plan, how to use that to make flashcards or practice questions to help your students learn. And then I'll also be talking about a couple interactive modalities, such as AI generated podcasts. And then also for more interactive conversational skills, I'll be talking about how I've used AI chat functions to practice standardized patient interviews and how you could integrate that into your own teaching. The resources that I'll be talking about today include NotebookLM, which many people have heard about already. It's Google's AI platform, it's free, and it's particularly useful for staying really close to source material. That's because you upload your own sources into NotebookLM and then ask it for it to give its output based off of your sources. So it, in general, does not pull much information from the internet. It's really focused on the sources that you provide to it. ChatGPT, everybody has heard of it at this point. OpenAI's platform. There is a free version. It tends to pull more from the internet, which can be good and bad. It's good because sometimes it'll fill in gaps that you might have in your source material, and it's bad because it is more likely to hallucinate because of that, or come up with false information that it pulls from the internet. And then finally, I'll be talking a little bit about a flashcard app that's very popular among medical students called Anki. If you haven't heard of it, it's a spaced repetition structure of learning where basically it asks you to grade the flashcards on how difficult they are, and then spaces out how often you see the flashcard, depending on whether you think it's easy or hard. And so it's very popular among medical students and something that I've integrated into some of my AI pipelines. So basically, my goal as a medical student, and I'm sure many of your goals as educators, is how do we take massive amounts of information and distill and condense it in a way that's really digestible for people. So most people at some point or other have received a slide deck of 100+ slides like this. This is an example from my neurobiology course this past spring, and it just has hundreds of slides and information that I have to learn. And this can be really overwhelming, and it's very difficult to process. And I'm sure that as educators, you're oftentimes looking at the state of the literature on a topic. There's so much information out there. There's a lot of resources that you can use, and you really have to decide, okay, how am I going to take all of this and communicate what students really need to know? So let's say you have 10 academic papers or a massive slide deck, and you want to create a lesson plan. So one way that you could do that really quickly is going to NotebookLM, which I just mentioned earlier. And you can go to NotebookLM, create a project, and then upload up to 10 sources into NotebookLM. And it can quickly integrate all of those sources. So basically, you upload those 10 or less sources, and then you can ask it to make an outline or create a lesson plan for you to teach students based off of. And this can be a really convenient way to condense information quickly. I personally use this before I go to class. I'll upload the slides for that day into NotebookLM. I'll have it make an outline for me. And then when I go to class, I already have an outline of the information that I'm supposed to know for that day. And then I can just add to the outline as I go through lecture. I follow along. And then I already at the end of lecture have a really condensed document of all of the information that I was supposed to gain from that lecture. And I've found it to be really convenient for that purpose. And then some of the benefits of this strategy that I just want to mention, specifically NotebookLM, is that it has reduced hallucinations because it's pulling from sources that you provide to it. And so it tends to be more accurate. Some of the cons are that the responses are only as good as the material that you give to it. So if you give incomplete sources to NotebookLM, it's not going to have a very robust output. So let's say I have my outline, you've created your lesson plan, and so now you have an idea of condensed information of what you want to teach to your students. And let's say, though, that you're trying to come up with things for them to do before they come to class to prime the information. You want them to have a base understanding of what to expect from the class for that day. So NotebookLM has a really nice functionality where you can actually create a podcast out of the information that you provide to it. And a lot of people have heard of this already. It's pretty fun. I will do this if I have some readings that I have to do and I just want a quick refresher of what's in the reading so that I can go into it with some background knowledge. But I think as a pre-work or pre-assignment before your students come to class, this can be a really great way of refreshing material, priming the information without bogging them down too much, because I think at least for me, I feel like I already read so many things that having a different modality of pre-work can be really helpful to just feel like refreshed with the information. So I'm just going to play a quick example of this just in case people haven't heard of this before, and then we can talk about it after.
Welcome to the deep dive. Today we're really getting into the spinal cord. It's that, vital superhighway for our nervous system.
Yeah, exactly. We've got some great materials here. Lecture slides covering the anatomy, blood supply, even some clinical applications.
Right. And our goal really is to cut through.
So it's pretty interactive and fun, and I think sometimes a more refreshing way of taking in material than directly reading it. So that's NotebookLM and some of the ways that you can use NotebookLM in your own practice. Another thing that I've found really useful for AI in my own life is using it to create practice questions. So if you have not already tried to do this with ChatGPT, I would highly recommend it, especially for educators, because I think it's important for you all to be aware that your students are probably already doing this. And if there's certain pitfalls of it, it's also important for students to be aware of that. And students might not realize because they see this as a tool to gain extra reps and practice with the material. So I think it's also important for you to see what ChatGPT outputs from the material that you're teaching to your students. So what I tend to do is I use the outline that I had just described that I created, and I copy paste the outline into ChatGPT and ask it to make practice questions. And the reason that I do that is because I'm asking it to stay really close to that source material. And I feel more reassured that ChatGPT will be accurate under those circumstances. And in general, I think it actually does a decent job of not hallucinating and creating questions that are close to the source material that I provide to it. I think the nice thing about ChatGPT as well is that you can ask it to create certain types of practice questions. So for me personally, I'm studying for step one, the USMLE exam, which is like our first board exam. And there's very specific types of questions. They ask a lot of clinical vignettes. And I have taken to asking ChatGPT to create USMLE style case-based questions for my studying. And that's been really useful too, because it has some background understanding of what a USMLE question is like. And so then it can change and alter its output based off of what I want. So I think one thing that's really important to remember with ChatGPT is the output is only as good as what you give to it. So it's important to be really specific. If you're not getting the outputs that you want, change your approach, ask something different. And you can be very specific to increase the applicability and clinical relevance of its output for your students. And I think that this strategy is especially helpful for solidifying known material and also showing any holes that I find in my knowledge. And I think that especially I think students are always looking for extra practice questions and more opportunities to deepen their understanding. And so this can be a great way to generate some practice questions, make sure that they're accurate, and then provide students with extra opportunities to practice. So this is practice questions, but now I'm going to talk a little bit about how students specifically, and myself and my classmates, have been using ChatGPT and AI in general to enhance our learning. So we just talked about practice questions, but what about students who just maybe struggle with a topic or need extra time to understand something? So one thing that I've taken to doing is almost using ChatGPT as a tutor. And I found many of my classmates do this as well, where let's say there's a topic that I'm really struggling with. I will ask ChatGPT to walk through the topic with me and explain each part of the processes. So in this example, I'm asking it to talk me through a certain part of the spinal tract and how it works. And so it's going in a stepwise fashion and asking me about each component of that spinal tract and the function of it. And it is very helpful if there's certain weak areas in a student's learning that they're aware of. And I think it can also be helpful for you all as educators, for students who maybe struggle with certain topics or need extra time or assistance. This can be a very useful way to ensure that they're getting some extra support. And I don't want to oversell the function of ChatGPT. Of course, like there's always pitfalls to AI. So it's always important to be aware of the limitations. But I think that for basic, straightforward, factual questions, I think that this can be a really useful tool for solidifying learning. So that's talking through concepts. Now I'm going to talk about creating flashcards. And this is something that has gained a lot of popularity among medical students, specifically using AI to make flashcards, because before, with the amount of information that we're learning in a week, it would take hours upon hours to make the flashcards to actually start learning the material. So now that I've created this outline, I can go to ChatGPT and I can ask ChatGPT to, oh, I think my thing is lagging. Oh, let me go back for 1 second. Okay. Sorry, I think my computer was lagging for 1 second. Okay, so I have an outline and now I want to make a flashcards. So I can copy and paste my outline into ChatGPT with some simple instructions about what makes a good flashcard and what format I want the flashcards in. And it will automatically generate a table with questions on one side and answers on the other side for my flashcards. And then I can use that to automatically upload my table into Anki, which is the flashcard app that most medical students use. And so this takes out a lot of the extra time and work of making flashcards, which is incredible, especially when you're in a program where you're trying to learn a lot of information very quickly. And sometimes I've actually talked to some students who have started doing this before they even go to class. So they go to class with a draft of flashcards. And then as they're in class, they're going through the flashcards and double checking them and making sure that they're accurate and are suitable for based off of the lecture content that they're gaining for that day. And so I think this has been very useful for me personally. And I think it's also very useful as an iterative process because let's say ChatGPT gives me not too few flashcards that are too high of an overview and I want more detail. I can go back and tell it, please give me more detail in my flashcards. I want it to be very granular, and it can recreate that with more granularity, which is really helpful. And then finally, I'm going to talk about the speaking function of AI. And this is specifically ChatGPT's, but I know a few AI models are coming out with this functionality. I personally have found this very useful for medical history taking. I'm not sure how many medical educators are on the call, but a very important skill that you learn during your first 2 years of medical school is taking a medical history and condensing it. And so I have been using ChatGPT to practice doing that. And just for some context before I play this video, everything that you see in the video is the only instruction that I gave to ChatGPT. I did not give any instruction outside of what you see me say in this video. So with that being said, I'm going to play this very quickly.
Hi, my name is Mitra. I'm a first year medical student and I have a standardized patient exam this week. Could you practice my history and physical and be a patient for me and then give me feedback at the end on how I'm doing?
Of course, Mitra. I'd be happy to help you practice. Let's get started. Whenever you're ready, you can begin by asking me about my chief complaint. Feel free to take your time.
Thanks. Could you tell me a little bit about what brought you into the clinic today?
Sure, I've been feeling this persistent headache for the past few days. It started out mild, but now it's pretty severe. I've also been feeling nauseous and sometimes lightheaded.
Have you found anything makes it better or worse?
Well, resting in a quiet room seems to help a little, but the headache doesn't go away entirely. It seems to get worse when I'm exposed to bright lights or loud noises. Also, I've been having trouble sleeping, and that might...
Okay, so that's just a brief example of what this functionality of ChatGPT can do. I think that some relevant points from this video. First of all, it creates a very thorough history. Like it will go through every single question that I have and has fabricated a specific disease that it's trying to express to me, and it tells me all of the relevant symptoms. At the end of this video, I ask it to explain the actual diagnosis to me and to explain things that I missed and give me feedback on my performance in the history taking. And it does a great job of telling me extra questions that I should have asked, things that would have been relevant to the patient's specific diagnosis. And I think that this can be really helpful if you're going into a situation that might be really unfamiliar. So I know that many of my classmates at Stanford have adopted this in situations where they're learning about a new specialty or they're going into a new rotation that they're really unfamiliar with. They'll ask ChatGPT, pretend to be a common orthopedics patient with a common orthopedics complaint so that I can practice what might be a usual complaint that I might see on that service. And so it's a great way to gain exposure to unfamiliar areas before you actually have to go have those conversations. And I think that the potential for this is actually really incredible. I have a friend who speaks in Spanish to the ChatGPT voice function and practices her language skills using this. I think that there's many, if you're willing to think a little bit creatively, I think that there's a lot of potential for how that this can be optimized to enhance learning in a lot of different spaces. And so especially for students with disabilities as well, if they don't learn well with visual tools, this can be a great way to change the learning modality and hopefully help address some of those burdens. And then just a few other applications of AI in the classroom. So I was just talking about using that for practicing different languages, but again, AI can also be really useful for meeting individual students' needs, such as translating course materials for multilingual learners, providing automatic meeting notes and transcriptions for students who might need a different modality of learning. And also supporting students with visual impairment through conversational AI tools. So I think all of these really have the potential to not only maximize your efficiency as an educator, but also to optimize your students' learning and make sure that they're receiving a variety of tools because not every student learns the same way. And so our goal should be to try to help students through all of the different potential modalities of AI. And this is just a reflection question for all of you, but to think about what challenges you face in the classroom and in what ways could AI be used to address those. A lot of the tools that I'm talking about today are challenges that I had faced as a medical student and trying to figure out how am I going to learn everything I have to learn in the very short amount of time that I have to learn it. And so I think thinking about those types of challenges and ways that we can address those is our best option for maximizing our use of AI. And this is just a final note on AI in general, because I think that we're at a pretty critical point right now where AI has a lot of potential, but I think it's also a little bit scary for many people. And so I think I always try to remind myself that the goal is to become responsible stewards of AI. We're not trying to, at least my personal goal is not to replace people with AI. I think that educators have a very important role in students' learning. We need real people to teach students. But how can we use AI to optimize and enhance and not necessarily to replace? I think that's the ultimate goal, to enhance learning, but not to replace it. And so I think it's still really important that students learn actual factual material, but we want to make sure that we are being responsible stewards of AI. So that includes fact checking and reviewing AI outputs, being transparent about how and when AI should be used for students, especially showing students errors by AI. I think that can be also really helpful for them in understanding the limitations of this tool, even though it's become so commonplace, knowing that it does fail and we have to be the safeguard against that is really important to keep in mind. And then also being aware of sycophancy, which is the tendency of AI to agree with the inputs that you give it. So it's important for people to be aware that if you give AI a really strong opinion, it will most likely agree with you, or it won't outwardly disagree with you. And then demonstrating how a minor change in prompt can lead to major changes in output and encouraging AI literacy among your students. So that is the end of my talk today. I really appreciate all of your time. And this is the AI tools cheat sheet if you want to scan the QR code, or if you have any questions, I would be happy to answer them at this time. Thank you so much for your time and attention.
Uh, Mitra, nice to meet you. Garrett Schramm from Mayo Clinic. There's a handful of questions in the chat. I don't know if you've had an opportunity to take a look at those, but I'm happy to kind of help facilitate some of these.
I
Um,
have, I'm scrolling through them right now.
yeah, yeah. I think the first one is can the AI system provide positive feedback? 'Cause like the humanism element that Dr. Calvin's talking about, and kind of referencing Dr. Paul LeBlanc's prior presentation.
Yes, I personally have found that ChatGPT, when I have the patient interview, is actually very good at giving positive feedback for the empathy and connection that I create and the rapport that I build with the patient. So in my experience, it has been capable of that. I know that some on larger scale studies, there's maybe some differences to that, but for me personally, I have found it to be quite useful. I don't think I tend to use it for that purpose specifically because I think that um, it's not going to be the same as talking to a real human. So I don't think I use it specifically for that goal, but it does provide positive feedback if I do build rapport with the patient.
Dr. Calvin, does that answer your question that you had?
Yeah, I think so. There's just so many real cool possibilities for how to use this, especially if the AI agent knows a little bit about you and knows where positive reinforcement might be useful.
Mm-hmm. Yes, especially I think if you provide it with things that you're challenged or struggling with, if you let it know, I have a really hard time building rapport with patients, it will spend extra time addressing that and trying to help you build better rapport and connect with your patient, which is interesting. Once it knows more about you, it will change its outputs.
The next one, and Mitra, I want to take over here as your moderator, but I just want to make sure we get questions. Do you use the standardized patient chat transcript in any other way, like reviewing the quality of the questions, making sure you asked all the questions? So kind of that quality assurance element, is that an element you've explored?
Definitely. And so that's what I tend to do afterwards is I'll go back and review, I'll read through what questions I asked, whether they were the right questions to ask, whether they were actually relevant to the patient's complaint. And I think that's also found to be really useful. One thing I actually realized I forgot to mention is that once I finish the patient interview, sometimes I'll ask ChatGPT to now pretend to be my attending and ask me questions about the patient and what might be relevant to presenting the patient to an attending. And it also does a great job of that. And that can be a really useful way for practicing kind of those more high stress situations where you might be taken off guard or get a question that you weren't expecting.
Right. Another question from Jennifer B. I'm interested to know if med student scores are higher using these practices versus those do not. So Jennifer's thinking like a researcher. It looks like she wants to do a comparative study here.
Yes, that's an interesting question. Jennifer, I would highly recommend you look at the research of Dr. Jonathan Chen. He is a researcher at Stanford. He does AI work, and some of his research is actually focused on medical school student performance versus AI. I don't think that he has yet done a study with medical students studying with AI versus not studying with AI, but he does a lot of studies that compare the performance of doctors and AI versus medical students and AI to see how we match up.
We've got a comment from Ricardo about using AI to help really, I think, strategize recovery, and had a discussion with his physician. So just a nice recap of using AI, and it sounds like the physician appreciated the knowledge base. We've got another question down the list here too from Dr. Jane. Can you use an AI agent to automate some of these steps?
Most likely, yes. I actually have recently heard from somebody that the app Notability, which is a iPad note-taking app that many students use, can actually do all of these functionalities in one place. Granted, it is expensive, and so you have to pay for it. And I'm a medical student, so I'm always looking for free tools and resources. But definitely those tools are in the making or already out there. So if you're interested in finding a tool that can automate all of those, I would recommend looking into Notability.
I'll just jump in with a question here too, Mitra, if we have. I can't remember what time we wrap up here. Do you recall? Sorry.
I think it's supposed to be a 30-minute session, so we might have like one more minute.
One more minute. Real quick question then. So obviously you did a great job of recapping the perspective of a med student and kind of where you're learning at your career. You know, the learners today are very much focusing on that continuing education environment, live, online, et cetera. I guess I'm just interested, you referenced about, you know, this is how learners today are learning, medical students. How do you see this kind of parlaying into or kind of feeding into your future where you go from learner to continuing education consumer? What do you think that's going to look like?
Well, that's an interesting question. I think that we will eventually have a change in focus from reinforcing factual knowledge to ensuring that people are maintaining their ability to think critically. I think that these tools, like I was saying, I don't think that these are going to replace humans. I don't think that we're eventually going to reach a point where ChatGPT is the only doctor, but I think what's going to happen is we might eventually have less of an emphasis on memorizing all of the facts, and like continuing education might be less about, do you still remember everything you learned from medical school? Do you still remember these random factoids? And it's going to be more about, do you have the critical thinking skills and ability to parse through this information and figure out what's actually true, what's not true, what's important, what's not important. And I think that that will be the focus going forward, hopefully, but it's hard to predict.
Awesome. All right. Thank you.
Yes, thank you. Thank you all so much for your time today. I appreciate it.